Now, please welcome to the stage our moderator, Steve Scully, a contributing editor at The Hill, in conversation with former Congressman Dr. Larry Bucshon, a physician and now a senior policy advisor at Holland and Knight. He was vice chair of the House Energy and Commerce Subcommittee on Health during his time in Congress. Welcome.
Thank you all. Sue, thank you very much for that insight. How's retirement?
Day 4. Yeah, so it's good. I was in Congress for 14 years. It's an honor and a privilege to serve. And I think we made some progress in healthcare and other issues with some of my input. So I'm pleased to now be in retirement from Congress, but not retirement from public policy, and being engaged in issues that I feel are important to me, and I'm going to continue to do that.
So as we can see from all the security around here, in just a couple of days, right over there, Donald Trump will take the oath of office. How do you think, in terms of policy, with Republicans, a very narrow majority in the House, a 3-seat majority in the Senate, and of course the White House, will affect public health issues?
I think in a positive way. I think you saw at the end of the last Congress where we had this large funding bill, and there was a lot of bipartisan healthcare pieces of legislation that were in there, and those were agreed to in a bipartisan way. Unfortunately, because of the funding situation and the size of the legislation, all of those got dropped out. So I think you'll see, particularly on the Energy and Commerce Committee where I served, and on Ways and Means that do most of the healthcare, a concerted effort to really bring back a lot of the bipartisan issues that will advance the ball down the field. I think that'll happen fairly soon, and I think the administration will be supportive of most of those things. Public health, obviously, is really critically important. I think we need to do more coordinating between state public health departments and the federal government, and I know that became a difficult issue during the pandemic, but I think you're going to see some good bipartisan work there, and the Congress will drive that. Anything big that happens in the House particularly is going to take some bipartisan work because of the narrow majority.
So on these issues, what I hear you saying, because we all get caught up in the personalities and the he said this, she said that, but what you're saying is that there's a lot more comedy, COMITY, than the attention is getting by the press.
Yeah, oh, absolutely. Behind the scenes, particularly amongst the physicians, and I think Dr. Schreier is going to be on next after this, and you'll see that. But I worked a lot with Dr. Barra, Dr. Ruiz, Dr. Schreier, and others on issues that are important in public health. I think there's a lot of common ground. And so behind the scenes, not only the physicians, but other people interested in healthcare policy will be pushing to make some progress. So I think that's right. I think, on issues that are really important in healthcare that we need to address, there's a lot more common ground than you would think.
So you told thehill.com, which by the way is a terrific publication, last fall, that when it comes to vaccines and public health, these are your words, we need to get to a normal place.
Yes.
So what do you mean?
Well, I think, let me just say this. During the pandemic, the doctors in the Congress did a lot of public service announcements, PSAs, promoting getting vaccinated with the COVID vaccine. And that was bipartisan. We did ones with our white coats on, we did ones without our white coats on, and we worked to influence our colleagues on Capitol Hill in a bipartisan way to make that happen. And I think it was pretty effective. So what happened is, though, particularly the COVID vaccine, as you know, became politicized, and then you started to see a lot of social media information that was not accurate. And we did our best as doctors on both sides of the aisle to counteract that. But as you probably all know, not a lot of people out there trust the federal government in many respects. And so we tried to do these things as physicians, and we had some success. So what I mean by getting back to normal is we need to get back to data, facts, science, and depoliticize some of the medical issues that I think were politicized, unfortunately.
But here's part of the problem, and your district is a more rural district, and when I travel back home to Pennsylvania and talk to family members who live in smaller communities, they're not believing Washington. They're not believing vaccines.
That's
there was a study that about 200,000 deaths during COVID attributed to social media because they felt that the vaccine was ineffective and could kill them. So how do you break through that?
Yeah, I think that's probably right. I mean, I represent a rural area of Indiana, and I can tell you, going around and talking to people, there were a lot of people who were very resistant to getting vaccinated. But primarily, I think because of the influence of social media and other information out there. And I said this recently in another interview that every medical therapy out there, no matter what it is, some people are going to have negative reactions to it. You know, if you look at the FDA would have a hard time approving aspirin today. Okay, if you went back and you looked at all the things that can happen if you just take an aspirin, and that's surprising. But if you go back and look, you'd find that that's true. So I think that's our problem. You know, the information needs to be depoliticized, as I said, and we need to figure out a way to better message to the American people. And one of the best ways, Doctors Caucus tried to do this, is through the local medical people. You know, we're doctors in Congress, but we have to have the medical people at the grassroots level, you know, the local medical societies and others, carrying these messages, because when you try to carry it top down, it doesn't necessarily get through, and we learned that. So I don't know if that answered your question, but I think we need to get back to that, and I think will happen. I think that will happen.
Sue was talking about Operation Warp Speed, and I had done an interview with President George W. Bush. He read a book about the 1917 pandemic and realized back in 2005, 2006, the U.S. was not prepared for ultimately what came with COVID-19. So my question is, when it comes to Bush, Obama, Trump, and Biden, how collectively among Democratic and Republican administrations Operation Warp Speed came together and the lessons it has for the next time, hopefully not soon, something like this happens? Yeah,
I think there's a lot of consistency at agencies. I mean, people are surprised. I mean, like, you know, if you look at FDA and other agencies, most of the people there are career people. You know, you have the political appointees, and I think there's been a lot of consistency across. If you look at the Trump administration at the end, it was just commented on Operation Warp Speed and Secretary Azar and others. A lot of that groundwork has been worked on for decades, right? I mean, the mRNA vaccine concept was there. They just harnessed that in a way that could speed up the process. So I think there's been a lot of consistency, and there still will be. Will there be political differences when you have new political appointees at agencies? Yes. But you know, I did a lot myself trying to help in my district tell people that, look, the CDC has been and the FDA were pretty maligned during this whole process. But the CDC is still, in most people's minds around the world, the preeminent institution as it relates to what they do. And I think that's what I think you'll see. So I think you're gonna continue to see some consistency because most of the people are career people. You'll see some political differences, but you'll see the lessons learned during Operation Warp Speed, and then continued on as it was fully implemented during the vaccination during the Biden administration as they moved through the first couple of years of that administration. Dr. Ruiz and I, for example, Raul Ruiz from California, have legislation on improving clinical trials. That was another issue, right? We had, you know, some of the criticism of the COVID vaccine was, okay, we had these clinical trials, but it didn't, the participants didn't particularly look like America, so to speak, right? And that was an issue initially, for example, in the African American population. You know, there was some concern there about were these things tested on more broadly. So Dr. Ruiz and we didn't get across the finish line, but we I believe really strongly that we need to work on our clinical trials. And if you improve that, so everybody out there knows, hey, this was tried on a broad spectrum of people all across ethnic and racial boundaries, and here's the data. I think you'll get more buy-in, and I think that was one of the challenges that we had. It's very complicated. I think let me just comment on data. Again, I talked to Dr. Walensky and Dr. Cohen, who were the CDC directors over the Biden administration. And I had legislation actually to try to improve the coordination between state public health agencies and the CDC, and it became very politicized as a database. But we need to do better in communication from, as I mentioned, from the grassroots level in a de-identified way so that people don't feel like their privacy. We've been doing this in science forever, right? Every study you read in a magazine, all the people that participate you don't see people's names written in there about who participated in the study publicly. But I think data acquisition and data accumulation and evaluation needs dramatically improved in the public health space, because if we don't have good data, then we can't make good decisions.
So I'm going to come back to that in a moment and talk about the politics of what we're about to undertake with the debate over the nominee for HHS. But I'm curious, you saved lives. You're a surgeon.
Yeah.
You come to Washington 15 years ago, as one of 435 members of Congress. And I'm curious, what surprised you the most about how that place works based on your own experience as a doctor, a surgeon, a physician?
Yeah. So people ask me that question. What's the biggest surprise when you came to Congress? And many of you won't be surprised by this answer. The amount of quality individuals who are actually members of Congress on both sides of the aisle. People, I think and people are surprised when you say that in your district. They'll be like, really? That's not what we see on TV. But look at the resumes of some of the people on both sides of the aisle in Congress. Are there people, on both sides that, you would say, well, maybe not. But the reality is that was the thing. I think we need to regain the trust in all of our institutions in this country, not only science, not only law enforcement, the government and other things, and realize that, look, yes, there will be issues, but most people in Congress that I know on both sides of the aisle are here trying to do their version of the right thing. You may not agree with their version, but that doesn't mean they're poorly motivated, right? Does that make sense? Mm-hmm. Their motivations are to help the people they represent, to help the country. You may disagree with how they're trying to get there, but I never, when I was in Congress, tried to figure out what motivates people, or say, well, they're misinformed, or they just don't understand, or this or that, or they're not intelligent, just because you disagree with what they're trying to do. I never did that. I always tried to figure out, okay, how can we find common ground here? Because everybody in this country sees things differently, and we have to come together.
So that's a perfect segue to my next question, which is, as Barack Obama said, elections have consequences.
They do.
And every president has the right to nominate the people that he, someday, hopefully she, will be able to put into his or her cabinet. But there is a lot of debate about Robert F. Kennedy Jr., mm-hmm. his background, his comments, his experience. If you were Senator Larry Bucshon and you were asking him questions, what would you ask him?
Well, I'm probably not going to get into that. I mean, I think I'll leave that up to my Senate colleagues.
Oh, come on.
No.
I think, among friends.
Well, yeah, among friends. Well, who said that in Washington? If you want a friend in Washington, you get a dog. I mean,
Harry Truman.
I get it. No, I'm just kidding, kind of.
So you're calling me a dog?
No. No, I don't want to comment directly on nominees. I think that's the nomination process goes to the U.S. through the U.S. Senate. There'll be, there's an FDA background check. There's going to be questions asked by U.S. senators, and I'm going to wait for that and see. I think I don't think it's fair to nominees, regardless of who it is, for me to comment on that before they've had a chance to make their case in front of the U.S. Senate. And we'll see where that goes.
But if RFK Jr. were here today, having interviewed him on a number of occasions, I think what he would say legitimately is we need to look at things differently. his Make America Healthy Again. So how would you look at things differently when it comes to vaccines, public health, and the role of HHS in Washington?
Let me just say this, and I'm not going to comment on what he might do, but we needed to do, and Congressman Wenstrup, who also retired, Brad Wenstrup, who was from Ohio, and I said this, he led on this. We need to make people healthier, and we need to focus on health and people being healthy rather than focusing on when people are unhealthy, how do we treat them? The big public health challenge I think you have in the United States is we've not done well on funding preventive care, for example. We need to create some alternative payment models on how we fund everyday health care, and make people healthier. A lot of people have said this over the years, but if people are healthy, number one, that's good for them and their family. Number two, it's more productive for society. People are back in the workforce. As a society, you're just better off. And it saves money, right? The healthcare system, I was a tertiary care doctor. I was a heart surgeon. I always just tell people, when you're talking to me, it's too late. It's kind of at the end of the road, right? Not that we couldn't do anything for you, but the time to really address their coronary artery disease was when they were in their 20s and 30s, maybe, when they started to have diabetes issues, when their blood pressure was high, when the things. That's what I see as how we advance healthcare in the U.S. And public health's a big part of that. You have to have ground level data so that policymakers can make decisions to improve the way that we make people healthy. And if we can do that, it saves money. The discussion in D.C. is always about, okay, how do we pay for it and who pays for it? We need to change that, in my view. We need to change that to, why is it costing us so much money, right, in the first place? Why is the bill really big, and why are we trying to figure out how to pay bills? We need to look at the other direction and say, okay, if we make people healthier, it will decrease the cost. And then the discussion about how we pay for it, who pays for it, will soften.
Okay, so let me take that one step further. What's your advice to those involved in this debate, alliances like our sponsor here today, the political leaders who will lead the discussion and the debate, and the civil service employees in all of these agencies that will help navigate the challenges ahead? Your recommendation is what?
I mean, be more engaged as ever. I mean, I think advocacy on Capitol Hill actually matters. I mean, I've been trying to get physicians, I told people, well, you don't actually have to run for Congress, if you're a doctor, but you should be engaged with your local political figures, your local public health departments. So, I guess my advice would be is more engagement. Don't be discouraged. It does matter. And you'll find, I think, in the Congress, I'll speak for the House, a lot of people are interested and want to listen, not just medical doctors, on both sides of the aisle. But the other thing, and I think I mentioned this earlier, is Washington and federal policy is kind of one thing, but where you can really, I think, have impact is local and state level public health improvements, right? You look at state to state and their data collection ability, for example, their IT systems were maybe decades behind in some states, and there was no coordination of collecting data. So, I mean, come and advocate in Congress and be vocal, but also try to think of ways to actually come from the bottom up, because ultimately what influences members of Congress is the people they represent. And the American people will drive this. And if you start at the grassroots level, you'll find that members of Congress will be like, oh, I'm hearing this from everybody in my district. My local doctor who runs the Department of Public Health in Evansville, Indiana, it's coming to my office and saying, here, look, we need to do these things. That's how you change it.
So I realize you don't want to get involved in what RFK Jr. may or may not do, assuming he becomes HHS Secretary, but if there is a policy that you think the public or organizations have real concern about, what do they do?
Well, I don't think there will be. I think that it won't get to, you know, and I'll just say this, and I'm not going to comment directly on cabinet secretaries or what they may or may not do. But for example, in Congress, I'll just speak to the Congress, and you all have had some of this experience. There's a lot of ideas in Congress. I mean, people drop legislation on all kinds of things, right? How many of them actually ultimately get publicly aired at a committee hearing or come to the House or Senate floor for a vote? So what I would say is to that is issues that I think that the American people aren't supportive of, that will be clear before actually all of us really know that's occurring behind the scenes. That's how it works in Congress. Members of Congress will be like, well, it doesn't look like that's something that's supported by a broad spectrum of the American people. So I'm not concerned about it. I think that you'll see consistency across all of these agencies, as I mentioned earlier, because there's political people and there's a lot of career people, and there'll be people that are sub-cabinet level. I think that you'll see in all the agencies, regardless of which administration it is, that are people that have deep experience in that organization, whether it's FDA, CDC, CMS, or others. Generally, sub-cabinet level people who are appointed will be people that have experience in those agencies for the most part, and will be able to advise the cabinet level secretaries about policy. And I think that's what you'll see.
So that's encouraging. One final note, because you're a former member of Congress, a doctor, and when it comes to, has nothing to do with healthcare, but is it Your Excellency in Japan, or what kind of title did you get from the Japanese government?
Well, it was now, and you asked me, now I'm trying to remember, it was
some high honor.
The Order of the Rising Sun, yeah.
The Order of the Rising Sun.
I think that's what it was. It was really a big honor. I mean, the Emperor, I was co-chair of the study group.
The Emperor?
It comes from the Emperor, yeah. I mean, it starts there. Technically, it's from the Emperor, and then it goes through the legislature of their diet, and gets, they get the Emperor gets recommendations from government level officials, and then they have it's kind of like maybe this isn't like the Presidential Medal of Freedom, right? It's a little step below that. But I was co-chair of the Congressional Study Group on Japan for the former members of Congress organization for many years, and I've been to Japan a lot. And I love the Japanese people, and I love their culture. And I did a lot of work through the embassy here in Washington, D.C., and got to know the ambassadors and the people below them. So they gave me this really great honor.
Congratulations.
Yeah, really great honor for my work on behalf of the U.S.-Japanese relationship, which is critical, by the way, critical ally in the Asia Pacific. And that's what it basically was about, is how I've worked to help further build that bond in Congress between our two countries.
Your Eminence, thank you so much.
Yeah, no.
Congressman, thank you.
You're welcome.
Real pleasure. Thank you
so much.
Thank
you all.
It was great. Thank you.